Recently, we have been seeing surge of COVID-19 in our country. It is therefore understandable why most patients will try to resort to unfounded medications to help them prevent COVID-19. And one of those agents that has been frequently asked by my patients is whether they can take ivermectin. So let's talk about that this afternoon. Is ivermectin safe, or is it proven to work for COVID-19? So what is ivermectin? Ivermectin is actually approved as an anti-parasitic agent. It has been shown to work in certain parasitic worms. In fact, there are also preparations of ivermectin in a topical solution to treat head lice and also skin conditions like rosacea. But you have to remember that there are some forms of these ivermectin tablets that are prepared for animals. And therefore, it's very critical that the dose of ivermectin, the active and inactive compounds, may be too large for human consumption, and therefore may not be safe for you to take. Ivermectin has been studied in the lab and has been shown to really prevent SARS-CoV-2 viruses, even dengue viruses or HIV, to attach to the host cell. It is therefore theoretically possible that if we give ivermectin to humans, it can prevent exacerbation or a humans from being infected from COVID-19. However, we don't have clear data yet as to the dose and how much is safe for human consumption. What's also very important that ivermectin potential anti-inflammatory properties. Although ivermectin has been shown to inhibit SARS-CoV-2 in laboratory studies, the doses that were used in the laboratory to produce those results was actually 100-fold higher than those approved for the use in humans. So theoretically, it may not be possible to replicate this in vivo or when you give ivermectin to humans for daily consumption. So what then are some of the proofs that ivermectin do work for COVID-19? Actually, there are multiple trials. However, there are trials that showed it worked. There are trials that showed it did not work. And this is where we need close studies and close evaluation of the different studies. The problem is most of the studies used for COVID-19, the use of ivermectin, had incomplete information and significant methodological limitations. Most of the studies actually had small number of participants. The doses and schedules of ivermectin administered were varied. The problem also is that they were confounded because some of the patients who were placed on ivermectin also were placed on other medications like steroids, azithromycin, or hydroxychloroquine. Furthermore, many of the studies did not clearly describe the severity of COVID-19, and some of the randomized controlled trials were open-label studies. So at present, a lot of different societies, including the Centers for Disease Control, including the National Institute of Health, have looked at different studies to show whether COVID-19 can really be stopped with the use of ivermectin. The National Institute of Health, which is the research arm in the United States, where we get funding for all the different research in clinical trials, have this recommendation that based on the studies so far presented to them, there are actually insufficient data for COVID-19 treatment to recommend either 4 or against the use of ivermectin for the treatment of COVID-19. In other words, they cannot really recommend its use because of inconclusive data. But if more data results from an adequately powered, well-designed, well-conducted clinical trials will be available to provide more specific evidence-based results, then the NIH can therefore provide us with more evidence-based guidelines on the role of ivermectin in the treatment of COVID-19. In other words, at present time, you take it at your own risk because they cannot recommend it as safe and of use in the prevention and treatment of COVID-19. Our very own Food and Drug Administration, in cooperation with major different medical societies like the Philippine Society of Infectious Disease, the Philippine College of Physicians, put forward a statement on the use of ivermectin for all of us to be guided, both physicians and patients, on whether we can use ivermectin or not. And they base it on a systematic review of 6 randomized controlled trials. Now, these are trials that are well made, that we trust in terms of outcomes. These are trials of good methodological quality. And the trials have shown so far that number 1, the use of ivermectin in the treatment of COVID-19, number 1, does not reduce death risk. Number 2, it is not associated with a definite benefit in terms of outcomes, like improvement at day 6 to 10, or clinical deterioration, or the need for mechanical ventilation. Number 3, studies have not shown that the use of ivermectin reduce the duration of hospitalization and the time to the resolution of symptoms. And number 4, the rate of hospital discharge at day 10 to 4 does not differ significantly. You may have some friends who are using ivermectin and they claim it shortened their hospitalization, it improved or prevented them. Unfortunately, again, this is the purpose of a randomized controlled trials. For example, I have been treating patients with COVID-19 who have mild, and these are patients who have been discharged on the 5th to the 6th day and to continue isolation at home. If, for example, I placed them on ivermectin, I would have said, or the patient would have said, good, ivermectin resolved my problem earlier when I was discharged on day 6. Unfortunately, no, because these patients of mine never were on ivermectin. It is for this reason that we need good data, good studies to really say that yes, ivermectin can work and we can start using it not only to treat but also to prevent. Unfortunately, for now, March 22, 2021, we don't have so far the conclusive evidence for doctors to really recommend the use of ivermectin for COVID-19. We will have to wait for more studies to come to really say that ivermectin do work.